introduction for teaching clinical reasoning. The objectives of this talk will be first to define clinical reasoning and its importance, to identify the limitations in decision making through clinical reasoning, and three, outline how to teach clinical reasoning briefly. I will start with the definition of a clinical reasoning. A clinical reasoning is the cognitive process necessary to evaluate and manage a medical problem. And really, clinical reasoning is a complex skill. It includes a lot of mental effort, and it starts with conceiving the medical information from the patient, then judging the possibility and to reason to make a choice for the diagnosis. And the whole process is centered around managing this medical problem. The elements of clinical reasoning include collecting cues, that to say the information from the patient, the history, which is very important, to process the information, to come to an understanding of the patient's problem or situation in terms of pathophysiology, to plan and implement interventions like investigations or emergency intervention and so on, and then to evaluate the outcome, which is very important. We need to have a feedback about the results of our plan, and this is important for further improvement or changing the plans, and to reflect on and learn from the process whether the result was positive or negative. It is very important. And in this diagram, we can see the stages of learning a skill. When we learn a skill, especially when it is a complex skill, we pass through three stages. The first stage is the cognitive stage, where we understand the task or the skill. يعني نستوعب هذه المهارة، شنو معناها، شنو فائدتها، شنو مخاطرها وهكذا. Then we pass to the stage 2, which is the intermediate stage. We can do the skill, but it is associated with less errors in comparison to stage 1, but still we are not very keen or not very sharp in doing this skill, because it needs refinement, which occurs in this stage. And then we go to stage 3, where the skill becomes autonomous. We don't need assistance from the seniors, and it comes to the subconscious control, and we do less and less errors. This progress in achieving the dexterity of this skill, it needs time, and the more the complex the skill, the longer the time and the experience that we need to master it. And in this graph, we can see the positive correlation, linear correlation between the years of experience and the diagnostic performance. The longer the years of experience, the better is the diagnostic performance. And so we come to the process of clinical reasoning, which depends on critical thinking. The critical thinking occurs in two main types. The first one is the pattern recognition, which is a non-analytic thinking, and it is used mainly by expert physicians. And the other type is the systematic analytic reasoning, which is used by the novices and also by the experienced physicians in complex or complicated cases. What is the difference between these two ways of critical thinking and reasoning? It depends on what is called the dual process theory in decision making. And we have, in general, two systems when we want to reach a decision about anything. We have system one, which is the rapid system that depends on identifying patterns. And this occurs quickly in a subconscious level. It does not need much energy to execute, and errors usually occur in this system, and it is highly affected by variables in the person and outside the brain of the person, and it emotionally it can be affected by emotions, while system two, which is the slow system, it is analytic and systematic, and it goes step by step. It needs effort and energy. It is more reliable, less prone to errors, but it is time consuming and it needs effort, and therefore in most times we like to use system one because it is easier and it is readily available. System two needs conscious effort, and this is not always available because especially at times of stress or at times of shortage of time. So how we progress from novice to expert, يعني من المبتدئ إلى الخبير. Novices to learn, they need rules. They follow the rules rigidly because they don't have much experience. They use inductive reasoning. They should know why they do these choices so that they know their limitations and they can think in one concept only. While the experts, after long years of practice, they use fuzzy logic. يعني logic ما معروف الطريقة مالته ضبابي. They jump from system one to system two and then return to system one and so on. They use schemas to help. They use their intuition, الحدس. They use several reasoning approaches for the same case, and they can think in more than one problem in the patient at the same time. They have adapted this skill. How a novice moves to an expert, it needs, this process needs time and effort. Probably drawing schemas will help the novice so that it will increase his understanding of the process. Practice and feedback are very important. Reflection or learning from mistakes and metacognition or understanding the way of his or her thinking and challenges. All these are important steps when we move from novice to expert. As I said, time is very important in this process. So why we need to teach clinical reasoning? The clinical reasoning is important because it is very helpful in preventing medical errors, which is a big problem. And also it will give the students the tools to deal with uncertainty, because as you know, my colleagues, you know that always we face medical conditions that are vague, or we are uncertain about the diagnosis because of many limitations, and learning to reason will help us to go through this case. It is important that the young doctors learn from experienced doctors. They need to attach to them to learn how to make decisions, how to approach difficult cases, complicated cases, and cases under stress, because they will get experience better rather than doing things by themselves. Sorry. Now we come for the diagnostic errors. Why diagnostic errors occur? Sometimes there is no definite fault that caused this error. Sometimes it is because of system failure. The system of work it has defects and will lead to errors, or because of failure of a human cognition. الإدراك عند الطبيب بمشكلة. طبعا what are the causes of this cognitive error? Could be knowledge gaps، أكو نقص بالمعلومات الموجودة عند الطبيب، misinterpretation of diagnostic tests results يفسرها بطريقة غير صحيحة، or there are cognitive errors and biases اللي يهمنا بهذا البرزنتيشن. الكوجنيتيف errors هي موجودة عندنا كل احنا. هذه الكوجنيتيف errors تسبب مشاكل خاصة عندما نكون تحت الضغط. What is the importance of reaching to a proper diagnosis? It is the first step for optimal care is to make the correct diagnosis. And this diagnosis can be missed or delayed in between 5 to 14% of acute hospital admissions. And this is an important or appreciable percentage. And autopsy studies also confirm that diagnostic errors can occur in 10 to 20%, and the autopsy will show the undiagnosed problems in about 1/4 of the cases. And this is very important. The cognitive biases, these are the subconscious errors that lead to perceptual distortions, inaccurate judgment, and illogical interpretation of information. And it occurs for all of us, and it is an everyday problem. And this is part of our nature. Human beings always, they do errors. Why these cognitive errors occur? These errors occur because our brain is wired to jump to conclusions. نستعجل بالاستنتاج. منت أن احنا دائما عندنا عجلة، نقفز على الأشياء حتى نوصل بأسرع وقت للاستنتاج، وهذا عادة تصير بسيستم 1 اللي حكينا عليه. See patterns that do not exist. يعني من يشوف حالة ممكن يتخيل إنه موجود فلان ديزيز اللي هو السبب، يتخيل يربط أشياء هي ما موجودة. or missing things، العكس، اكو اشياء موجودة يغفل عنها مو بإرادته، ولكن لأنه البرين يكون متوجه إلى diagnosis واحد. طبعا أيضا شيء مهم, our estimate of probability is also poor. We don't take in consideration the probability. We may give large or big weight to rare conditions, and we forget about common conditions. Also, the context in which the clinical reasoning is occurring, that's to say, the circumstances affect the decision making. Could be in the clinician, like sleepiness, or getting bored, or not experienced, or gaps in the knowledge, or the patient is making a lot of problems, or the patient does not give the right answer about his presentations, or because of some psychological problem makes things difficult. Also, system factors can affect the care. Many patients in a short period, and this is a common problem in our consultation rooms and emergency rooms. All these can affect the decision making. And as you see, even if many doctors and nurses are there, still diagnostic errors can occur. So how we can prevent reasoning errors? It is important that we have guidelines and evidence-based medicine to decrease the chance of making errors. We should be open-minded, and we should be aware about our cognitive process. This is called beta cognition. And always we need to understand our errors, and we try to analyze them and avoid future mistakes. How to teach the clinical reasoning? How we do the clinical reasoning part of our curriculum. As you know, the diagnosis starts with collecting the information by history and physical exam, sending investigations. Then we summarize the case. We put a differential diagnosis. Then we try to find which illness scripts, يعني نصوص الأمراض that match the scenario of the patient, and then we put the management plan. It is important that we teach the students how to reason, because this will help them to build their experience, and they will understand how they can make use of their knowledge that they got it in the first 3 years. So in step 1, the student should take the history and physical exam and present the data about the patient. Step 2, he should learn to discuss relevant semantic qualifiers like acute and chronic, mild or severe. مثلا نجي على الكف, is it dry or productive? It is continuous or intermittent, and so on. These are called semantic qualifiers. These will translate the terms of the patient to medical terms so that we can understand it by pathophysiology. Then we construct a problem representation that can summarize the case of the patient. In step 4, as I said, we compare the presentation of the patient to illness scripts that the student should learn. And in step 5, we select the most suitable illness script, and we put the management plan, like further investigations and treatment and follow-up. We need to vary our approach depending on the grade of the student. first of all, we need to develop the knowledge acquired by the student and put it in pathophysiological principles. Then we encapsulate them, we put it in illness scripts, and these illness scripts will be used for the clinical reasoning. The human factors are very important in decision making because they affect the way we reach decisions, and pilots, they pass a human factor exam. As you know, the pilots should be ready when they do their job, because any mistake will be disastrous, and also doctors, their mistakes will be disastrous. But unfortunately, still till now, many clinicians, they have poor understanding of human factors, and this is should be taken in consideration. Assessment of the reasoning ability of the student and the doctor can be done by some tools. This is an assessment of reasoning tool. It is produced by the Society to Improve Diagnosis in Medicine. It can, after completing this form, we can get an approximate assessment of the reasoning ability of the candidate. Also, there's the script concordance test. This is a modified multiple choice question that help to give the student or the candidate the opportunity to compare his abilities with the abilities of a panel of experts. And this is an example of a question format used in script concordance test. And lastly, this is a take-home message. Clinical reasoning is a complex skill that is essential for the doctors. This skill needs time and experience to develop. Many factors can interfere with the proper decision because of cognitive errors and external factors. And teaching this skill is important for solving complex cases and to minimize errors. Thank you very much.